What's good, everyone? Welcome to another episode of Docs Outside the Box. I'm your host, Dr. Nee. I'm joined by
Dr. Renee.
All right, so we are in an interview. This is an interview type of episode today, and let me start off by saying that for me, paying off debt, student loans, credit card debt.
What all the things you hate in the world? These are a few of my most hated things.
Getting my own place, honing my clinical skills.
Okay, now we getting into a different, I don't know what song to sing.
Let me finish. Let bro finish. Honing my own clinical skills for when I practice, and then getting an Audi S5.
Okay,
You know what that was?
those aren't things that you hate.
Those were the things that I was focused on when I was finishing residency as well as fellowship. That's what I was focused on.
Okay.
Right? Like that was the list. That was the ultimate Dr. Nee Darko list, bucket list of things he wanted to get done when he was finishing up fellowship.
Okay, but where am I on this list?
So that's what I want to know. What were you focused on when you were finishing
No.
residency?
Where am I on your list?
Hey, that's for another episode. Those are problems that we could talk about another episode.
Wait till this recording ends.
That's not what we talk about here. So for you, what were the things you were focused on when you were finishing residency? Minus sans Nee Darko.
Who said you were on my list? Anywho, I don't know that I had anything very specific. I'm very, you know me. I'm more let's just see what happens kind of thing. I mean, I guess I was focused. If I had to say I was focused on anything at the time, I think I was focused on having an academic career.
Okay, so an academic
Yeah.
career.
Yeah.
I'll leave it to like this. Was starting like a new practice in your
Oh,
thoughts?
definitely not. Definitely not. At that point, I knew I didn't even want a private practice, but like I said, I wasn't even focused on what kind of practice necessarily. I was just really more focused on academic medicine, which I guess you could say is, type of practice. But
usually if you're in an academic field or if you're going into academic practice, you're walking into basically a already pre-made practice, right? So I'm saying, what if I threw in starting your new practice, maybe having to recruit doctors?
Yeah,
and let me
no.
just say, recruit doctors who are more senior than you while you're in fellowship.
Okay,
What
well,
if I told you that?
well, that's a whole totally different ball game.
Okay.
Yeah.
Recruiting other staff.
Yeah, no. No.
And also trying to get ready for fellowship.
No.
Yeah. So that is the animal. That is what we are going to be discussing in this episode of Docs Outside the Box. So we have a doctor, I wanted to say a very forward-thinking doctor, Dr. Brooke Choulet, who is on here to talk about all of these things that not only was I thinking about, you were thinking about, but also there's other things of starting your new practice, getting more doctors who are more senior than you to work, convince them to follow your mission on a practice that hasn't even been created yet, y'all. I'm telling you, a practice that hasn't been created yet, y'all, recruiting other staff, getting ready, and letting them know, hey, I'm not even starting fellowship yet, right?
Oh, my gosh.
So we're going to be talking with Dr. Brooke Choulet. She is a concierge psychiatrist and the founder of Choulet Wellness. It's in Scottsdale, Arizona. She completed her medical degree, guess where?
Where?
You know where, at the University of Missouri, Kansas City.
Really?
Yeah,
UMKC?
Yeah, she went to UMKC. I thought you knew that. You didn't know
No,
that?
I didn't know
Yeah,
that.
she went to UMKC, University of Missouri, Kansas City. They have a 6-year program where you get your
Okay,
BA
yeah, I know that,
as well as
yeah.
your MD in a total of 6 years. We have experience with them because we, between UMKC as well as University of Kansas, all three of us on a medical school basis would get together and have
Yeah.
events and so forth. So we're very familiar with the UMKC program. And then after she finished that program, she went and did a general psychiatry residency at the University of Arizona. And then from there, she decided to continue her training and continues her training. She ain't done yet.
Wait
we
a
talked
minute.
while she's still in fellowship.
Wait a minute. Boss move.
There's no wait a minute. She's doing it right now. She's doing her training.
Seriously, really ain't no wait a minute.
Right. So she's doing her child and adolescent psychiatry at Creighton University right now. And she's in the last year of her program. And we talked about, well, look, before we get into what we talked about, one thing that I think people may have heard is concierge psychiatry. So I think everybody knows what psychiatry is, but concierge. So for the medical students, the residents out there who are listening, concierge medicine is basically you are paying a membership fee. You as the patient are paying a membership fee, and with that you get direct access to your doctor.
Right.
So we're talking about you get like same day appointments. So if you call on a Tuesday and you're like, hey, I just need to talk to a doctor, my doctor right now, you get access to your doctor. You get access, like a direct bat phone line to your
Right.
doctor. So if you have an issue going on and you call a specific number, you're going to get directly in touch with your doctor.
Yeah.
He or she is going to be picking up the phone. That's at 1 in the morning. That's at 5 in the afternoon. It doesn't matter.
Right.
And then oftentimes, and this is not just psychiatry, but depending on what field you're in, if your patients need direct access or they need subspecialty care, usually in a concierge model, the doctor is like directly facilitating that subspecialty care. So you can get access to whatever other physicians that you need.
Right.
Oftentimes you can get easy access to labs. You have the ability to get labs done, drawn quickly, all in the office. So concierge medicine is like this membership-based system that gives you more of like a traditional based before government got involved,
Right.
before insurance
Insurance
got involved.
companies,
It
yeah.
kind of brings it back to more like a pure sense of how medicine should be practiced. Now, what we talked about in this episode, we talked about, we got really focused and poignant on what we're going to talk about, but we really talked about things like what's her typical day like, which I think a lot of people want to hear.
Right,
Why did she
right.
decide to start doing this, thinking about this while she was in residency and definitely in fellowship? What's it like building boundaries with her patients? How does she develop boundaries with her patients, particularly when she has this type of model?
Right.
It's psychiatry. You can't really predict how she's been able to get like a predictable practice and how she's able to give people her direct number.
Yeah.
You know how
especially while she's still in training.
Right. And how and then the last thing is like, how the hell are you able to convince people who are more senior than you
That's
to come and work with you on your practice under your name?
That's what I want to know.
So this is going to be a dope episode.
You're
This
like,
is,
hey, Mr. or Mrs. Attending, sir, you want to come work for me?
I tell you. But listen, this is all about forward thinking. This is Docs Outside the Box. I hope you guys enjoyed this episode. Let's get right into it. What's good, everyone? Dr. Brooke Choulet, welcome to Docs Outside the Box. How you doing?
Good. Thanks for having me.
So I've heard you to be described as a unicorn, mainly because you do concierge psychiatry. But I've heard you on different podcasts. I've heard you on the Scope of Practice podcast. I've heard you on other video/YouTube type podcasts also. So I wanted to have you on because it's a very unique way in which you practice psychiatry, mainly in a direct care model or a concierge model. Can you tell us a little bit about that? And then we'll jump into some further questions.
Sure. So I work with all of my patients directly. So the second they get through my screening process with my care coordinator, they are only talking to me from there on out. I like it because I see some kind of pro athletes or celebrities or people who really would not want their name to be disclosed or going around a bunch of staff in the community. I'm also the Phoenix Suns psychiatrist, so discretion is a must.
Well, after this past year, they definitely need it. They lost 4 straight games. Come on, yo. What'd you talk to them about?
Oh, man, I know. It's so hard to be an athlete, too. There's like so much pressure. And so I love it. I communicate with them by text, email, whatever. And I have fewer people, but really spend a ton of time with them. So that's how I like to practice psychiatry.
So that's what you call concierge medicine. This is basically, rather than you work directly with insurance companies, you technically kind of work directly with patients. Or
Yes.
in this case, working with the Phoenix Suns players or the Phoenix Suns in general, you work directly with the Phoenix Suns. And that means in some cases, like they have direct access to you, right? Like they're not calling your office if they need to reach you after hours. They're calling you directly. Is that correct?
That's correct. So if anyone of my patients needs to reach me, they contact me via my work cell. They could text, call, whatever, and get a hold of me.
So I'm just thinking about like, damn, like I ain't never given my patients my cell phone number, right? Never directly to my. So what? Talk to me about why that works. Why do you do that, and why does that work?
Yeah, one thing is because I'm pretty type A. So like I'm afraid that if someone needs a refill and they call my office, I'm never going to get that message or it's going to be delayed and then the patient's going to be upset. So I like it if they just text me and they're like, hey, I'm out of my meds. I'm like, no problem, send. So that's one thing. I like that control factor where there's no lapse in communication. And then the second big thing is I think that it makes people feel more comfortable when they're dealing with less people in the room kind of thing. So that direct kind of care, in terms of the accessibility, like I love my patients. They are awesome. Like no one's texting me at 2 a.m. They're all really respectful of my time and they're all professionals. So like they don't have time to be texting me at odd hours. So it works, but boundaries are really key.
Yeah, I know that boundaries is really important. Let's jump back to that in a second. But I want to also throw one thing that the audience doesn't know, or they may know if they've heard you on other podcasts, is you started your practice while you were a resident, right? Is that correct? Did I get this correct?
You got that correct.
So I know most of the time when you're finishing your residency, you're looking for your next job, which for the most part is going to be some type of hospital employed gig or maybe private practice possibly or something like that, or work for someone else and then get your chops up and then start your own practice. But how the heck did you start your own practice while you were a resident? Why'd you even have that in your mind? Tell us about that.
Yeah, so I had that in my mind because of exactly what you said. You feel like if you finish, you have to either go employed or do some kind of a hybrid model where you're starting your practice, but then doing something else. So I wanted to have everything up and running so that the day I graduated fellowship, I could just easily glide in full time into my own practice. So that's where the idea came from.
Yeah, but most people are like, I got to get my chops up. Like, because you don't know anything about billing at this point. You don't know anything about, like, you don't have an established patient, population that is coming in. That didn't scare you or anything like that? Like,
I was plenty scared. There was many a moment where I was like, oh, is this a big mistake? Am I going to regret this later? And there was lots of doubt. But I just went for it because I'm like, if I don't go for this, I'm going to end up being employed by the end of this.
So talk to me about being employed versus like working on your own. Like, do you have like an aversion to that? Because I do. So like, what is that thing? Was it that strong that you're like, I got to do something on my own?
Yeah. And I wouldn't say aversion, but it's like we work so hard as doctors to like finish and then do what we love, right? So I don't want to do what I love, but then have C-suite down my throat saying like, oh, you need to have this many discharges or this many admits or see this many consults. That just does not sound appealing. Like, why did I go through all this to have someone else telling me what to do? So I really wanted to create an environment, not only for myself to do what I wanted to do, but for the people who I brought on to join me to like also be empowered that they could create an ideal work environment.
Okay, so while you're in residency, you're bringing on people, correct?
Like
these other doctors?
Yes, other doctors, a nurse, and therapists.
So, okay, hold on. So these are doctors who are established, correct?
Yes, I mean they're board certified. They're out of training.
They're more senior than you, and they're saying that they're going to jump into a practice that technically hasn't been started yet, and when it starts, it's starting by someone who's still in training.
Exactly.
So talk to me about that conversation. How'd that conversation go? That's crazy. That's crazy.
Well, basically what happened is I had this idea, which concierge psychiatry is really not common. So that in and of itself was kind of unique. And I started telling people about that purely just from like a networking standpoint. Like, hey, I'm here, I'm opening this, I'm like going to do this. And I got a lot of like positive feedback. People were like, whoa, this is really cool. Like, tell me more about this. And so as I started talking to more people, they were like, I want to join you and do this
so
too.
So nobody else is doing this? Or is that what you're saying? Like at the time?
I think I know of like maybe 5 to 8 national concierge psychiatrists.
Really?
Yeah.
So when you're talking to well-established docs, they're like, this is a great idea, but she's already working on the structure. Let me jump in with her.
Right. And not only that, but it's the first kind of multidisciplinary space like this in our area where it's not only mental health and like, psychology and therapy, but also nutrition coaching, facial skincare, and like Botox fillers.
Okay, so, full disclosure, you come from a family of psychiatrists. Your mom is a psychiatrist, and I think you said your grandfather is a psychiatrist, correct?
Yes.
Okay. So what did they think about, because obviously I'm sure they didn't start out of residency or while in residency, or tell me something. What did they say when you were like, yeah, I'm going to start it while I'm in residency?
Well, my mom was super excited. She was like, I know you could do it. You're going to be great. So she was really excited. My grandpa was always in academic medicine, heavy in research, heavy in juvenile inpatient work in Cleveland, Ohio. So he was kind of like, I don't really understand what you're doing, but if you want to do this, you should go for it.
Okay. Okay. So starting on your own, right? Like, because, the way in which we go backwards and talk about things, the rectal spectroscope, basically, like everything sounds smooth and nice and stuff. Tell us what it was like in residency to kind of figure out how to start your own practice. Talk to us about that. Did you hire a consulting firm, or did you do this on your own? Like starting an LLC, like all of these things, like it's a lot of stuff that they ain't teaching us, right? That's the point of this show. Is like you're not learning this in residency. You damn sure ain't learning in medical school, and I think you did a fellowship also, right?
Yeah, so I'm currently in fellowship. So I finished.
And you just took your boards too, right?
Mm-hmm.
Did you? Well, I'm not gonna mention it, but whatever
no,
it was,
I haven't found out yet.
So everybody, listen to this. She is interviewing right now. She has 2 practices opened up right now, one in Arizona and one in California, and she's not finished and has a full-fledged 2 practices that are doing very well. So that's what's up. So take us through that process of like, how it all started.
Yeah. So I think what you said will resonate with all the med students and residents out there is like consulting firm. Like I don't have money for that. You're in residency and trying to figure it out. And I think one thing I can pass along is that a lot of people do moonlighting for extra money, whether it be for traveling, paying off loans, whatever it is. I did moonlighting to pay for the startup costs of my business because it's like, I'm loan averse. Talk about averse. I'm loan averse. I don't want to be in debt.
Outside the box. Yeah, that's what I'm talking about. You need to come on the show and just separately to talk about how you avert loans. I like that. Keep going.
Yeah. So I don't like loans for personal things. So I moonlighted. I did a bunch of calls, a bunch of rounding at inpatient psych hospitals to pay for my practice startup costs. And then I just actually quit all of my moonlighting last month. So that was a big exciting moment for me. So I'm done with that. But yeah, I used all of my moonlighting money as startup to kind of, pay for those things like accounting and, opening a business and deposit for an office space and all of those things that cost money.
How much do you think initially, if I know you can't give us the exact numbers, like to the 26 cent, like, no, but like in general, like as a resident, how much do you think you put out realistically to start this practice?
Yeah, what's funny is the commercial furniture was like way more expensive than I ever thought it would be. So I think I want to say my legal fees and accounting and all that good stuff and like the LLC, probably like $20,000.
$20,000.
And then for all of my furniture for a 2,800 square foot office space, I want to say was like retail 65,000. So that I think all of my startup costs were like those 2 things combined.
And you said you took no loans, correct?
No loan.
Okay, so you did it mainly off of moonlighting money. So so for the medical students who are unaware of what moonlighting is, basically that's when you are working as a resident. Like the hospital doesn't have, or the program doesn't have all of your time, but if you have a day off or if you have a vacation, you can actually go work as a practitioner, maybe in the ER or whatever it may be. In her case, she was working as a psychiatrist, I'm assuming, in another facility providing services and getting paid for that. So you would take that money and you would use that to start your LLC and things like that, right?
Right. Yeah, exactly. So, and then the other thing is time. Like I wake up way too early. I go to bed way too late. And I just would research online, like how to do various things. So like, I don't want to pay an attorney to start an LLC. So I figured out how to do it myself. And so things like that are money and time saving, because then if you want to scale, you can do it yourself again. You're not paying a lawyer again to make another LLC. So, I made 5 LLCs by now. It's like just second nature. So,
and all of those expenses become tax deductible, right, which means they lower your taxable income of what you bring in. So I heard you say this on another podcast, but talk about that. You talked about it really quickly, but if you were to go to a consultant, whether it's a lawyer, whether it's a CPA, they are very useful. But when they see the DR in front of your name or the MD or the DO, what happens?
it's all more expensive.
Yeah, it's like
Yeah.
it's like trying to buy something during a wedding, right? Or like
Uh-huh.
wedding season, like they just upcharge everything. So
Right. Yeah, you got to do your research and just really talk to other entrepreneurs in the area, get kind of good names from other people, kind of ask around about pricing before you tell them you're a doctor. And also I'm really young. So when I approach them too, I think it's pretty noticeable. Like I probably don't have a lot of money yet. You tell them you're in training and they know that you're not making very much compared to what you could be making.
right, so they should understand that this is a long-term relationship and that they should see you from the beginning all the way to when you are fully fledged, bringing in a good, healthy income. Well, let me ask you a question. When you finished residency, how much did you get accomplished in terms of like your business or the practice? What was done by the time you finished practice or you finished
Yeah.
residency?
So that one's tough because with psychiatry, residency is 4 years. But then if you go to child, you spend your 4th year of residency as a first-year child fellow. So when I was board eligible, which was this July to start seeing patients, that was after my first year of fellowship. So I started working on this at the tail end of my 3rd year of residency, all through my first year of fellowship, so that when July 1st hit this year, I opened my doors and I was ready to start seeing patients.
Okay. Now, what has this done to your mindset? Because I'm really interested and fascinated. You've already opened up 2 practices. I'm interested. Like most people would say, okay, as soon as I finish residency or training, I'm going to go open up my own practice or work with somebody else. But by the time you finish fellowship next year, you already have 2 practices. I'm assuming if you already got 2, you might as well go to 3. You might go to 4, blah, 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 blah. Like, this is a safe space. How much clinical practicing do you plan on doing more so towards increasing and expanding your business and scaling it? Talk to us about that balance, if there is such, and go from there.
Yeah, I love what I do. And also, I think people respect a leader that's still doing what everyone else in the office
Yeah, you
is
got to be in the
doing.
trenches.
Yeah, so I love it. I think my caseload is a little less just because I do have to focus so much on just like moving everyone into our space. We move into our brand new space in 2 weeks and like making sure that all goes well. So I have my kind of select grouping of clients and then I focus on them, but it also gives me time to kind of give my love to the clinic too.
Okay. Now, listen, you have currently how many doctors working for you?
I have, well, if you count one of them's my mom, so she's not really working for me. She's
Gotcha.
working with me. So she joined my Arizona practice, but then her and I started the California one 50-50 together. So the one in Arizona is still my baby. So I have her and two other psychiatrists right now. I have 2 psychologists, a therapist, an esthetician, and a nurse.
Okay, so you are going 360. You ain't playing. Like, you want healthcare and positive health promotion in
Yes.
your practice from the get-go. Okay, let's circle back to what you were talking about with boundaries, right? It's similar to, you're into real estate and I'm into real estate. We talk about that. Like, I want to get real estate, but I don't want to get called 2 o'clock in the morning for a toilet that overflows, right? Obviously, nobody's going to call you about a toilet that overflows. People may be asking you about maybe a psychiatric emergency that they quote unquote feel that they're going through, or they just feel like, you just get nervous about like, I don't want to get calls all through the night and so forth. Talk to us about that. What is a typical night like? What is a typical day like? What is it like working with these people who have direct access to you? Like, that is the whole, that's the point of this type of relationship that you have with your patients, that they can reach you for the most part anytime. But how do you set the boundaries to make sure that you can still live your life, you can still go out and have a drink or what have you, and go from there?
Yeah, so I think just having that accessibility actually to you, like actually decreases the amount of calls and texts that I get. I think it's almost like that anxiety of not being able to reach you is what drives a lot of like portal messaging and texting and, all these things. So I'm really lucky that like I haven't had a situation yet where I was like, hey, we need to slow down and let's set up an appointment. Everyone is awesome. Like I'm super lucky.
You think most of those things come from not abundance, but the opposite of scarcity, if they feel like they can't get access to you?
Right. And they all can. Like, I carry my work phone with me all the time. I have like a second iPhone that's purely for work. So if I get like a unknown call, I always answer it just in case it's like a pharmacy or something. So I really like it that way. I think one time I had to tell like a 17-year-old, like, you know what, calm down. Like, let's talk with your parents in the morning. And it wasn't an emergency. The kid was just frustrated, and just like having someone to go to is helpful rather than like TikTok or blasting their emotions on Twitter.
I got you. So 3 o'clock in the morning, they could reach you.
Technically they could, but I don't even sleep with my work phone on right next to me. It's
Gotcha.
like I'm not an emergency. I'm not a crisis center. All of my paperwork states that it's really just so you could get a hold of me if you need to for any like scheduling, clinical questions, things like that.
Okay. All right. So listen, I think we overall covered like the really amazing thing of starting this while you're in residency and obviously technically still in training and thriving and scaling. Listen, for the med students, the residents, the young attendings who are listening to this is maybe their first time hearing about concierge medicine or direct primary care. Maybe interested in doing this. Maybe don't want to become an employed doc or what have you. What are the 3 things that you think can help them get to the point where what you're doing, similar to what you're doing?
I think a big thing is overcoming fear. If I look back, I was really scared throughout this whole process. And then not only that, but then when you're in medical school and residency, everyone around you is employed, right? Your attendings are obviously employed at the academic center.
Your grandfather's employed.
Yeah, they chose that for a reason. So asking them or telling them what your plans are, most likely you're going to receive back like, are you sure you want to do that? Like, maybe you should get a job here first. So I think overcoming fear is a big one because you can't move forward if you're paralyzed by fear. Yeah. So that's one. I think having a mission and like knowing what your vision is, because I think that's how I was able to grow and get people, like you said, like board certified doctors working for me who's like a fellow, because I had a really good vision and they could tell I was passionate about it. And I did deliver. At the time, they didn't know if I was going to deliver on it or not. And then like getting a coach, there's so many physician coaches out there who it's like they've already gone through this. They could save you a lot of time and tell you about like how to navigate certain things or the mistakes they might have made. And then creating a business plan in which you kind of identify goals, maybe objectives, like how much money you might need to start something like this. So just making it like, I always tell my patients, you can't wake up with a 20-item to-do list. You have to make it digestible and have like a few things each day. Because if you look at a 20-item list and one day you're going to be overwhelmed and most likely you're not going to do it. Yeah. So digestible, small steps.
Yeah, you know what I do? I tell a lot of people who are like, well, how do you keep up with X, Y, and Z? I actually make my list the night before. I make like, just like you said, I make 3 to 5 things that absolutely have to be done in the morning. Because I've tried it where I'll have like all of these, electronic versions of list keepers and all of those different things. And in the morning time, you're like, I can't get through any of this stuff. You feel overwhelmed and you don't handle it. But if the night before I said, okay, these are the 3 things that absolutely by the morning need to be done, I could just quickly check them off. It just puts me on a roll. And some of those things are as simple as make your bed, just to get me on a roll and stuff. So I definitely agree with making shorter versions of lists. Well, listen, Dr. Brooke, man, this was dope. I'm just saying congratulations to you. Listen,
thank you.
If someone, because you're talking about physician coaching, but if people want to reach out to you and say, hey, I want to get some advice from you on how you did it, how can they reach you? How can they learn more about you and your practice?
Sure. Yeah. They could reach me through my website, which is just my first name, last name, MD.com. So BrookeChalet.MD.com.
Boom. Hey guys, we're going to put that in the show notes. Once again, unicorn in the field of concierge psychiatry. This was really dope. This is really dope, Dr. Brooke. Thank you again for being on Docs Outside the Box.
Thank you for having me.
There it is. That's it. What you think?
Boss lady.
Yeah, she's a boss.
Boss lady, for real.
Or at least she's willing to take some risks that I think a lot of people aren't willing to take. So
yeah, I mean,
what say you, Dr. Renee? What's your takeaways?
Yeah, I think definitely the risk taking, like, you know me, I'm a risk taker. So I love to see things like this where people are like, you know what, I'm just gonna try it, even though I maybe haven't seen anybody do something like that before. But my main takeaway funny enough is like her doing this, I think is so reflective of what we talk about on this podcast. And it's, really thinking outside the box, especially in comparison to kind of old school thinking, right? Like her experience, particularly with telling her grandfather what she was going to do, and him being, old school psychiatrist.
Academic Ivy League psychiatrist.
Right? Yeah. And he's like, what are you talking about? Right? Like, I don't even...
Who taught you how to go and do concierge psychiatry? Sound like Chris Rock on...
Nobody taught me.
On Kanye West's album.
Right? And so, we talk a lot about how, we're kind of breaking the mold, and we're doing things that no one has, either thought to do before or that very few people do. And we've seen a lot of your guests on the show do exactly that. And she literally is like almost the epitome of that, because as a resident, you're sitting there thinking about, I'm going to recruit attendings to come and work for me. Like, that's unheard of. And I just love the fact that her mom, who's like the generation in between, like jumped on board, and so is now a partner. So I just thought it was so indicative of everything that we do here on Docs Outside the Box. So,
my biggest takeaway is, look, you can't move forward if you're paralyzed by fear.
Yeah.
Fear plays a huge factor in how successful you're going to be. Fear plays a huge factor in what you deem as risky or not. And to be honest with you, I don't even look at this as a risk that she took, right? Mm-hmm. I think that if you're fearful of things, you perceive certain things to be risky when they're not, or you perceive certain things, bad things could happen when they're really not bad things, right?
Right.
The worst case scenario is she has two options. She could either be employed, work for a hospital, or actually three things. Employed, work for a hospital, or work at a medical school. 2 is have her own private practice, which is kind of similar to what she's doing right now. Mm-hmm. And 3, do what she's doing.
Right.
Either way, she's not going to be in a poorhouse.
Right. Right.
The question is doing something that nobody else is doing, particularly in her specialty, is she willing to try it out and see how it goes?
Right.
And yes, and I agree with you. These are the things that we are talking about on Docs Outside the Box. These are the things that we want the medical students, the residents, as well as the young attendings to understand. Mm-hmm. There's multiple ways to skin a cat.
Yeah.
So for me, we talk about mindset all the time. We talk about how it's important to embrace the growth mindset. This is another example of someone who has all of the skills and the training clinically and is now expanding her thought process, expanding her network by getting coaching, by utilizing her upbringing, by talking to her grandfather, who's a psychiatrist as well as her mother, and then taking the next level and saying that I'm not going to be limited by what they're doing. Right. Let's do something else. So for me, it's huge, y'all. Fear is a big deal. And it's something that I think we all got to embrace. The question is how are we going to respond to it? So,
yeah, I mean, speaking of fear, and you touched on this just a little bit, is that what exactly are you fearful of? Are you more fearful that the thing that you're thinking about doing is going to fail? Or are you more fearful about not doing what you are thinking about doing and essentially either falling into the status quo, or staying exactly where you are? And for me, she kind of proved that, she was more fearful of just falling into the status quo.
Oh, yeah, because she was very clear. I don't know if y'all caught that.
Yeah.
She was very clear in saying that, I don't want to be employed. Mm-hmm. I don't want insurance companies telling me what to do. That was her. Yeah. That was the ultimate. I don't know if that was the ultimate failure, but that scared her to the point where she was like, I don't want that. I'm going to go the complete opposite way. Yeah. And what's the worst thing that's going to happen is, I feel like, I'm kind of constricted in some form or fashion. Yeah. So anything else you want to add on that?
No, this was a dope episode, yo. Anybody who is out there and is thinking about doing something and you are scared to do it, you need to think about Brooke Choulet.
Yeah. So listen, y'all. Listen, we want to hear from you guys, everybody who's seeing us on YouTube. Listen, we have a Docs Outside the Box survey. The link is going to be in the YouTube description. If you're listening on the podcast, it's going to be in the show notes. This survey is in partnership with InCrowd. And when you click on this link, it's going to take you to a very quick survey that allows us to hear from you. It allows you to let us know what you want on future episodes. if you want episodes like this. Do you want episodes where me and Renee are kind of like talking heads, where we're punditry or punditrying or whatever you want to call it? Whatever it is, we want to know what you want. Listen, it's a quick and easy survey. We're doing it in affiliation with InCrowd, which does medical surveys. So make sure you click on the link. And then also, listen, another way that you can tell us immediately how you feel about a situation, if you like an episode, if you have an opinion, if you like our opinion, is text us. Let us know. It comes directly to my phone, to Dr. Renee's phone. You can text us at 1-833-230-2860. Alfred, telethon style. Put it down below. 1-833-230-2860 will also be on the show notes. So far, a couple of people have written us and let us know.
Justin, we're going to be answering your question very soon. So, stay tuned.
Yo, Justin and his feelings, yo. He's like, yo, what's up with this and what's up with that? What's up with the awning and stuff? So we got you, Justin. We got you, all right? So listen, everyone, we're going to end this episode right now. We got to go pay the bills. So listen. Let us know what you think. Make sure you fill out that survey and also fill out or text us at 833-230-2860. We'll catch you guys on the next episode of Docs Outside the Box, where we are fusing money, medicine, and mindset. Making it happen?
Almost.
All right, y'all. We'll see y'all later.
Peace.
Peace.